Thank you, Bill Trattler, for inviting me. I'm going to be talking a little bit about high-dose fish oil, triglyceride fish oil. Sometimes you'll hear me call it RTG, that's re-esterified triglyceride fish oil. And I'm a certified nutrition specialist, an optometrist, and a fellow of the Scleral Lens Society. I have a few disclosures. Friend of Bill. That's probably the most important one. This is kind of a busy slide. What we have going on here is basically micronutrients and macronutrients and how they've changed in the past 100,000 years. I kind of eat as a hunter-gatherer or paleo, and the purpose of my lecture is more about fats. And if you look at the omega-6 and omega-3, it's a balance all the way up until the 1900s, and by the 1950s we're getting the trans fats, thank you Crisco, and vitamin C levels have gone down, omega-3s have gone down as well, while omega-6s have gone up. The typical, what we want is a balance of omega-3s and omega-6s, about a 1-to-1 to a 1-to-3 ratio, and now it's like a 1-to-20 ratio. So this is kind of opposite to what I just talked about, but something's just not right. Our air is clean, our water is pure, we get plenty of exercise, everything we eat is organic and free range, yet nobody lives past 30. Probably has more to do with lack of antibiotics. So can we get enough EPA or omega-3s from foods alone? And this is kind of small for you guys, but I think that, well actually I know that EPA is the anti-inflammatory component of fish oil, and when you look at fish and certain foods that have EPA in their marine ones, the highest concentration of EPA, or the greater ratio, is actually in crustaceans. So Alaskan king crab, you get a 2-to-1 or 2.5 ratio for EPA to DHA. So you'd actually have to eat, in terms of salmon, to get around, we want around 1,700 milligrams of EPA, at least that's what some of the studies are showing, to help with dry eyes. And you'd have to have 3 servings of anchovies a day to get to, actually 4 servings, 3 servings of salmon to get to those levels. So most people aren't going to eat that way. I practice what I preach, and this is my omega-3 index. The PRN is actually offering that here. I just got my blood tested yesterday, but this is an older blood test from actually 2010. And I've been recommending TG fish oil for a long time. At the time, I was taking about half the dosage of what's recommended now for dry eye. And since I eat mainly pescatarian, I had 11%. Typical Americans around 4% or less. And the great thing, there's an excellent study that shows people who go above 8% have about a 90% risk reduction in having a heart attack that kills you, sudden cardiac arrest. When you take a good dosage of triglyceride fish oil, everybody goes up above 8%, and I'll show you a study in a bit. In terms of the different types of fish oil, a lot of the fish oil on the market, unfortunately, is ethyl ester. That's actually not even something found in nature. Ethyl ester is something that's made in the chemistry lab, and your body actually has to convert ethyl ester into the triglyceride form in the liver. And part of the reason why liver enzymes can go up with taking Levasa, the prescription medication, is because of that harsh conversion. And it can also cause GI distress, but that's mainly because it's not as, it goes bad easier, and then the fish burps and other GI symptoms. So you just can't really get therapeutic levels with ethyl ester. I probably should have said that this is triglyceride, what Gregory Smith is referring to. He says in a recent article in Advanced Ocular Care that he has an 80% success rate with 700 patients in terms of treating dry eyes with fish oil or triglyceride fish oil. Who remembers Phil Hartman, Cold and Blow? Hold it, is that what you're having for breakfast? Sure, haven't you heard? Fiber is really good for you. Think fish oil. Well, there's fiber, and then there's high fiber. Try this. And so, if you remember, there's like 1,000 bowls of cereal. So this is how much fish oil you need to take from the drugstore brand to equal a therapeutic dose of RTG fish oil. That's maybe a little bit of an exaggeration, but this is probably better, showing that you do have to take like a bowl of drugstore fish oil to get the right levels. And so we talk about therapeutic dosing, and I I think that we may be prescribed, recommending a higher amount than may be necessary to help, but it does help, and you don't have side effects in terms of, the studies have been shown that the blood thinning properties is really not, it's more like a myth in medicine, and I can send anybody that study if they want to read it. There's more bioavailability with the triglyceride type fish oil, and even the cost, if you compare with absorption, it's cheaper to take triglyceride fish oil than ethyl ester because of the absorption. So who do I give fish oil to? I give fish oil to myself, my giant schnauzer, that's Google, and playing the video. Somebody wants some fish oil. Okay, we're going for the next one. I just found out this hotel is dog friendly. So dry eyes in the cataract population. This is all my friends. Jody was here last night, and Bill Trattler, and Usnego. He left already, but they did an excellent study on 200 eyes, and they found that 59% had blepharitis, and 61% had decreased tear breakup time. So it's really important before cataract surgery, before LASIK, to treat the ocular surface. Because dissatisfaction comes from 28% dissatisfied with LASIK because of dryness. Before I had my own clinic, I worked in a large ophthalmology clinic in northern Florida, and we treated this was back in 2008. We treated everybody with triglyceride fish oil before and after LASIK, and our rate was about 2% of dry eyes afterwards. And then IOLs, you have to have a great multifocal IOLs. You have to have a great tear film in order for it to work well. My main protocol is I put everybody on fish oil, whether you young or old, especially contact lens wearers. I pretty much recommend fish oil to everybody. There's a few studies. One that I'm going to be talking about a little bit today that Alice, one of the co-authors, they found that the tear breakup time improved about 3.5 seconds. There was another study that the patients had started with a lower baseline, but they used the triglyceride fish oil, and it improved about 2 seconds, even with a little bit lower dosage. I'm also a big fan of hyaluronate preservative-free drops. Oasis Tears makes one with that. And I fit scleral lenses too, so I put that into scleral lens bulb. I think it was Alice who mentioned hypochlorous acid earlier. Was it you? Well, that's with Avenova. And here's a question for you guys. What percentage of fatty acids is found in the meibomian secretions that are actually bacterial in nature? 10 to 15%. So, and that's in the average dry eye patient. 10 to 15% of the fatty acids that you find in the secretions are actually from bacteria. So, you got to treat the bacterial aspect of dry eye. And so cyclosporins, antibiotics, steroids, and maybe refer for lipoflow. I've done that before. All right. So, what proof do we have that omega-3s have therapeutic value in MGD? 70% of patients, this is one of the proof of concept ones where they took a small sample size, 20 patients, and they found that 70% of them were completely asymptomatic after taking a 3-to-1 ratio of EPA to DHA, and that was from the PRN. The improvement in tear break time was clinically significant, and everyone who had corneal staining had improvements at the end of the study, and I believe it was a 12. It might have been a 6-week study. Then they took it to another level. This was the results presented at Ascaris in San Diego, and Alice was one of the people in that study. When we found that, like I said, around 1,700 milligrams of EPA, and it's got a ratio of 3 to 1. And I believe that's important, but time will tell if that's really true. But I do know for sure that the anti-inflammatory aspect of EPA is helpful. And they hit their primary endpoint was tear osmolarity, and they also did a lot of secondary endpoints. So it was a double mask. We don't like to say double blind in the ophthalmology field. It was double mask. And 105 subjects, multi-center, and basically we found for the osmolarity, there was from baseline, there was definitely an improvement, clinically significant. When we look at the MMP9, there was a trend towards clinical significance. That's inflammation in the tear film. For basically the subjective complaints, the ocular surface disease index, there's definitely a big, and now the control group was actually safflower oil, which it was funny, there was a little bit of an improvement there in the beginning, and sometimes I actually do prescribe omega-6 to patients. Not that often, but I do it based on the results of that blood test, because I probably should have pointed out earlier, but it also tests for DGLA, and DGLA has been shown to improve tear production, aqueous tear production. So sometimes I actually do prescribe omega-6s, so I kind of see why maybe it improved just a little bit in the beginning, but by the 12-week mark, it definitely had a lot more clinically significance with the omega-3s. Tear breakup time doubled. That's huge. Omega-3 index, well, that's a no-brainer, because if you take a high-quality fish oil that's triglyceride-based, it's going to go up. And so everybody started around 4, and they went up to, oh wow, they didn't hit 8. Okay, well, they get close to 8. Maybe they needed to eat a little bit more fish or take a little bit more. But they did really well. I was 11%, that's why it's kind of surprising. All right, so the reestified triglyceride form of fish oil, it improves tear osmolarity, tear breakup time, improves the OSDI, and increases the omega-3 index. There's also some trends towards helping with the MMP9.